Hello, 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 and welcome. I'm Dr. Tracy McClellan, your instructor for the Medical Assisting and Phlebotomy course. Every day that you come in, make sure you signed in so you can get credit for being here. Today, we're going to go over your course syllabus for medical assisting / phlebotomy. And then all of you should also receive a copy of this syllabus as well. So let's go ahead and jump into that. Let me pull that up on the screen so that you can see what I'm looking at. Okay, so what you should see on the screen is a copy of the medical assisting and phlebotomy syllabus for this course. I will be your instructor for this course. Our address has changed. It is now 810 North College Avenue. This was our old address, and we just need to update that information on there. Our office hours are 8 a.m. to 4 p.m., so that part has been updated as well. The course you're taking is a certified clinical medical assistant and or phlebotomy, or both of them. So we've combined that segment of the course. Course description: your CCMA or your PT phlebotomy technician medical assisting is a 15-week intense course taught for entry-level healthcare providers that teaches individuals how to function in a physician's office. You're actually going to establish physician office ready skills and knowledge base to assist the physician and the nurses in the care of patients ranging from infancy to elderly, health-related illnesses, and the necessary care needed. So that's for the clinical medical assistant. Now, for those of you who are also doing phlebotomy, the medical assistant course encompasses phlebotomy training, so that's how we can combine those two together. And we just always have a fantastic time. This is based on when you enrolled. We offer this course in 4 different semesters. Some of the required materials that are needed for this course textbook, the Hartman's Medical Assisting, the basics. You should receive a textbook and a workbook. You're going to need a 3-ring binder, notebook to put handouts that we will give you during the course. We have a hole puncher available. You should be able to put all of that in your course 3-ring course notebook. You're going to need highlighters, pens, and pencils. Every day you come to class, you're going to need those items. If you have any cold-like symptoms, we advise you to wear a mask when you come to class. If you're coughing, we expect you to get up and go get your mask. If you're coughing more than once, yes, because no one wants whatever it is that you're coughing with. Even if it's a common cold, please be courteous and cover your mouth, but also go get your mask. If you didn't bring one with you, we have some at the front desk with Miss Lisa. Uniforms for this course are the solid black scrub top and scrub bottom, and then the white lab jacket that goes mid waistline, mid hip, goes at your hip level. They do have lab jackets that go all the way down to your knees, but we don't want you to wear that long. Those are called physicians' lab jackets. So the white lab jackets, you will receive in your tote bag 2 badges. One goes on your right shoulder of your white lab jacket, and the other badge goes onto your left upper chest area on your black scrub set. Make sure it's above the breast area. It should be up high, okay? On the left-hand side, let's see what else. White shoes, white tennis shoes, white Crocs, any of those work fine. If you're a male, I'm okay with you wearing black Crocs or black shoes. Females, definitely all white shoes. The method of instruction for this course, there will be a lot of video lectures, pre-recorded video lectures. I will also be floating back into to help with answering any questions. I do expect while videos are being shown that everyone will be courteous and not have your own private conversations going on that would keep others around you from hearing what's being taught on the video. They are just as important as if I was standing in front of the classroom giving the lecture at that moment. You should be highlighting in your book. You should be taking notes. And then if you have questions and I'm not in the room to answer your question, just jot the question down. We will certainly take care of those questions that same day. So virtual training was basically when we were doing Zooms during COVID. So you won't have any virtual trainings. They will all be live. Assigned readings, videos, learning workbook and assignments, course handouts, online website assignments as to view, and then group discussions. You will also have lab skills checkoffs. So once we get past the first week or so, we're going to start having skills checkoffs almost every day. The grading scale for the medical assistant is as follows, just like we went over in orientation. An A is a 90 to 100, a B is 80 to 89, a C is 75 to 79, a D is anything below 75, actually 70 overall. On your final exam, you must make at least a 75 to be considered passing. And technically, you made it that far, that's not usually going to be a problem. Labs, when you do lab checkoffs, it's either a pass or fail. Either you know how to do the skill once it's been demonstrated and you practice spend some time practicing, or it's a fail. So it's a pass or fail for the labs. For the medical assisting, there are 26 chapters. So you have your work cut out for you in those 15 weeks. You'll be doing multiple chapters per week. So listen, you have to stay on top of your reading, on top of your workbook. You will also get a grade for completing the workbook assignments as well. So you do not want to get behind on any of that. So if you're taking both the CMA and phlebotomy, you will take 2 final exams. You will take the medical assisting final exam, and then you will also take the phlebotomy final exam. Major exams count for 60% of your course grade, and all other assignments, handouts, and submissions will together count for 20%. And then, of course, your other assignments will also, your final exam counts for 20%. Okay, course requirements. All major course exams must be taken in-house. We will not be emailing any major exams to you. All clinical labs must be completed in full uniform. So the days that we actually assign you to wear your uniform, you must make sure that you are wearing the full uniform. And let me tell you what is considered full uniform. Your black scrub set, your white lab jacket, and your right color shoes, and your hair up off of your neck. Minimal jewelry. You can have 2 or 3 jewelry necklaces. You shouldn't have an earful of earrings. If you have the unusual, I guess I shouldn't call it unusual. If you have the ear piercings and it's hanging out of your nose, you cannot wear those on days we're wearing your uniform. The days you are assigned to wear your uniforms, you are demonstrating to us that you understand how you're supposed to look when you go to clinicals. Yes, so that's what you're going to be demonstrating to us, that you know how you're supposed to look when you go to clinicals. You cannot wear the nose earring piercing. The little drop in the ear, no problem. But if it's the kind that's showing out of the nose, that is not permitted to wear to clinicals. So whatever you need to do about figuring, you cannot have the long nails, and they should not be long colored nails when you are dressing to demonstrate professionalism. So you want to figure out what you're going to do about that. If your nails are really long, you're going to get dinged on your grade for that, because then you're out of uniform. Okay, so watch that, because we can't send you to clinicals that way. So we don't want you to come to class in your uniforms with that on as well. Absences is a big deal. Listen, we do give you 2 days of grace, but if I were you, I wouldn't even take those 2 days. And definitely don't take those 2 days and then need additional days, because you will be terminated from the program. We are watching your tardies and absences very carefully. So try not to be tardy and definitely not absent. If you are going to be absent from class or something is happening and you're going to be late, you must call the 8680 number. I'm going to have a lot going on every morning, so you'll be better off to contact Ms. Lisa so that she's aware that you're going to be late or that you're not coming that day. If you are not in school, I shouldn't have to wonder, has anyone heard from you? Because you should have called the front office, okay? So make sure you do that. That's vitally important. If you're on a payment plan, Ms. Elisa is going to go over with you your installment payments, and they must be kept up on time. If they are not, then there is a late fee of $25. So you make sure, once she gives you your schedule, that you make sure your payments are presented on time. All homework and classroom assignments must be submitted on time. In the event you are absent, your assignments are due. So say, for example, if you come back on Tuesday and you're absent Monday, then your homework is due on Thursday. So you just got to have it presented the following day once you return. We don't bring children to school or definitely not have them in the lab. When present in the classroom for labs, be on time. So you may need to wipe down the area that you're going to be using. So you need to get there earlier than what normally be expected. All students must pass the final exam with a 75% or above to successfully complete the course. All skills listed must be checked off before satisfactorily completing the course, okay? Now, the schedule of events is going to change, so I'm going to go over this very, very briefly, but it's going to change a good bit. So I'll give it, we're going to pass this out to you, but please know that this is going to change. So week 1, we've already completed CMA and phlebotomy. We've already looked at the medical terminology. We've already done your abbreviations and military time and body positions. So you guys, we will be going over the results of that today. And then you guys also took the general knowledge quiz, or if you haven't already taken it, you're going to take the general knowledge quiz. Week 2, we just progressed from week 1. You'll be taking the abbreviations columns 2 exam. We'll begin to look at the venipunctures part of the phlebotomy part of the course, because we combine the phlebotomy and the medical assisting together. So we start with the phlebotomy part for both of them. And for my medical assisting students, you're going to be looking at chapter 24 in your textbook and your workbook. And my phlebotomy students, you'll just begin with chapters 1 and 2 for homework in terms of your reading and beginning to work in your workbook. We are also going to begin talking about the flow of blood through the heart. That's always very, very exciting. So the next video you watch after this one will cover, well, after we look at the role of the medical assistant and the role of the phlebotomist, then you're going to be looking at a separate video that covers the flow of blood through the heart. So that's always pretty exciting to me. I look forward to sharing that with students. When you first hear the lecture, you know, surely we don't have to learn all of that, but you do, and you will, and it will be behind you once you complete it. You should also receive tote bags this week. So we have a full week ahead of us, as it will be that way every single week. It will never be a dull moment. Let's see. So as the weeks progress, we'll continue to go through what is going to be covered. I'm just going to scroll down here and look at toward the end. At around week 9, 10, we'll prepare to start getting ready to go to clinicals. My phlebotomy students will head off to clinicals earlier because their course will end sooner. But we will begin to prepare to go to clinicals, get you guys signed up and scheduled to go out to clinicals. And guess what? We don't go to clinicals with you. You will be assigned to a facility and go out. You will go to the clinical site at the allotted day and time, and you'll meet with the clinical administrators that are already at that facility. That's why we have to ensure while you're coming to class that you know how you're supposed to behave, that you know how to be professional, and that you know how you're supposed to look, what's expected of you before we release you out to go there. You'll do about 3 to 4 weeks of clinicals, doing venipunctures for my phlebotomy students and both my medical assistants as well. And then medical assistant students, of course, also out doing medical assisting things in your clinical sites. Final exams are usually after you've completed clinicals, and that will be scheduled toward the end. And then make sure when you go to clinicals that you receive back your evaluations. Without evaluations, it's almost as if you did not go to clinicals. So we will give you the documentation that you're supposed to take with you when you go to clinicals. For my medical assistant students, this is the textbook and workbook that you're going to be receiving. It looks like this. It's kind of thick, but not as thick as some medical assistant books. This is a very thorough book. It covers everything you need to know. A part of the course training is you reading this book. You are not going to be able to depend on just my lectures. You have got my lectures going to tell you some information, and it's going to refer you to this book. Everything you need in basic form is going to be in this book. What I love about the workbook, which is not as thick as the book, the workbook is, if you do the assignments in the workbook, you would have covered every single word and detail that you need to be successful on the state exam. Remember, always begin with the end in mind. That was said by Stephen Covey. And what that means is, think about the day of the exam, what that's going to feel like when you press that submit button, because you've answered all of the questions, and now you're pressing the submit button. What answer do you want in the end once you take that state exam? And that particular exam will give you a pass or a fail. And what answer do you want to come back when you click submit? This will be determined on your accountability and you being responsible for reading, when I give you reading assignments, and for doing this workbook. You will not be able to skate back. Don't copy anyone else's book, because then the information won't be going into your brain. You want to spend that time digging into the book. That's what's going to make you excellent. That's what's going to cause your brain to retain the information. So you want to make sure you do this for yourself. If you're in the phlebotomy course, you will also receive a course textbook, which is not as thick because phlebotomy doesn't take as long, but you have a phlebotomy textbook and then also a workbook, which is very thin. Same thing there. If you dig into this workbook and answer those questions that they're asking you in the workbook to get through the phlebotomy book, you will do excellent on your phlebotomy exam. Those of you who are enrolled into both medical assisting and phlebotomy, you'll take 2 state certifications. You'll get 2 certifications at the end. When we have graduations, you'll walk across the stage twice. So that's a pretty exciting thing to keep in mind as well. Okay. All right. So we're going to be continuing to update the syllabus and what we're going to be doing each week. That's why I didn't spend a lot of time going over the details that are listed here, because it may change a little bit. Some of this is tentative because it varies based on the group. I can tell you that there's 2 major projects within the first couple of weeks if you're in medical assisting and phlebotomy, and that is, we'll start off with the anatomy of the heart, and then you're going to have to do a poster on the anatomy of the heart, you know, what I mentioned before, where you're having to draw a heart and then demonstrate your knowledge of the flow of blood through the heart. Okay, so that's always exciting. Students come in and they are prepared to present their posters on the flow of blood through the heart. Another project that you will be doing shortly after that would be labeling the tube colors for venipunctures. So say, for example, a physician says that they need a CBC on a patient. You will be demonstrating on that poster board all of the different tube colors, what type of orders or tests that can be ordered for those tube colors, what are all of the extra detailed things that has to go along with those tube colors. And we'll go over that more in detail as we get to that. But that's another major presentation. When you do those types of presentations, you get a couple of grades. One grade is for professionalism. How did you present your poster? Another grade is, did you have knowledge of the information that you're presenting on the poster? And then the other one is, what does that poster look like? You know, were you creative? does it have all of the information that's supposed to be there? And you're gonna have time to gather all of that before that's due, okay? All right, so that covers the syllabus for the medical assistant and those of you who are doing the phlebotomy as well. I'm Dr. McClellan, your instructor for this course, and I look forward to an exciting semester with you as you prepare yourself to become a healthcare professional. Okay, fantastic. Of course, if there are any questions, I will be in a position to answer those questions for you. But that concludes the syllabus and introduction for medical assistant. Actually, it does not. The next thing I want to share with you is the course overview, the role of a medical assistant. So give me a moment, we're going to watch a short video and you get to see what medical assistants actually do. Let's make sure that we got sound here. Share computer sound. There we go.
In the healthcare field, there are many important roles that incorporate patient interaction. Medical assisting is an area within healthcare that focuses on supporting the doctors and nurses that provide medical care to patients, while also directly interacting with patients regularly. Medical assistants are vital members of the patient care team, covering important elements of the patient care lifestyle, including recording patient information, history, and vitals, assisting with diagnosis and treatment, ensuring patient comfort, and supporting the medical professionals as they apply the treatment. In fact, much of the initial patient interaction and support comes from the medical assistant. Medical assistants provide support in both administrative and clinical tasks related to patient care. Medical assistants work with people of all ages. Babies and children, adults, and the elderly all receive support from medical assistants throughout their medical care. This includes preventative care for healthy patients, as well as those who become ill. Because of the range of administrative, clinical, and supporting tasks performed by medical assistants, it's important that they're well-trained, detail-oriented, have excellent customer service skills, and enjoy helping others. Medical assistants provide support to doctors and nurses on a variety of tasks, including greeting and rooming patients, providing administrative support in the office, obtaining and charting a patient's vital signs and symptoms, assisting with diagnostic testing, and administering injections, prescriptions, or care as ordered by the doctor. It is safe to say that the role of a medical assistant plays is very important to patient care. Medical assistants also ensure all required health and safety protocols are followed at all times, and that equipment is maintained and sterilized after use with each patient. Medical assistants work in a variety of healthcare settings, including doctors' offices, medical clinics, and hospitals. Medical assistants also work in assisted living homes, occupational health offices, rehabilitation centers, laboratories, testing facilities, and home health companies. Depending on their interests, a medical assistant can select a patient group as a specialization or preference. For example, a medical assistant could work at a children's hospital or with a pediatric group if they enjoy helping children. There are many other options too, such as working with the elderly in a geriatric practice, urgent care, or even specific diseases, such as dialysis clinics for kidney disease. Because of the specialized clinical and administrative tasks medical assistants perform and the health and safety protocols required, it's important that medical assistants have technical training and administrative skills necessary for success and safety. The best way to demonstrate both is to enroll in a certificate program that provides coursework in these areas and that gives you the hands-on training opportunities of an internship or externship. Those that complete a certificate program and who also successfully complete the nationally registered certified medical assistant exam may have even more opportunities for employment. As medical assistants work in many types of healthcare settings, there are shifts available at almost any time of day. A medical assistant could choose to work a standard day shift, long hours but with fewer days per week, or even overnights and on weekends. Many jobs offer both part-time or full-time employment options. Some also offer opportunities to work overtime for additional pay. Regardless of your schedule desires, you should be able to find an employment opportunity that meets your needs, though in some cases, you may have to relocate to find the right employer and role. Medical assistants are needed in all states, and the skills and experience learned in a certificate program and on the job can be used in virtually any medical assistant role, especially for those that have their certification. Between the opportunity to work different shifts and the ability to work in most locations, medical assisting provides excellent flexibility. It's a great field for parents, military spouses, and those that enjoy helping others. Ready to learn more about training to become a medical assistant? That's great. Visit our website, imbc.edu, to learn more today.
When I started Walton Goggin's gogggle glasses, I knew I'd be its fancy name and pretty face, but I didn't know how to turn.
Okay, just had to get back on there. Okay, all right, so that goes over the role of a medical assistant. You can see, as I mentioned, the different various skills that you have to perform as a medical assistant. And then we're going to continue to explore the role of a phlebotomist and what medical assistants do in terms of venipunctures, as well as the role of the phlebotomist as well. So remember, the medical assistant course is 15 weeks. The phlebotomist course is 9 weeks. So we're going to be moving together, and of course our phlebotomy students will get finished first. Let me make sure there wasn't anything else I needed to cover with you on this. We did the syllabus and we did the role. Okay, so that covers our overview for medical assistant. So I look forward to working with each of you. Thank you.